Hey everyone, with the increasing amount of debt from dental school, paying back loans is becoming more and more of a stressful task for many students. There are a couple of different repayment options, however, and one of them happens to be through the military. Each branch of the military gives you the opportunity to pay off your loans, and today we're going to focus on how the Navy does it. For this episode, we have Kevin Hildebrandt, and he is an HPSP recipient, which is through the Navy, and he's a D4 at the UCSF School of Dentistry. Kevin, thank you for being here today.
Thanks so much for having me, Nick. It's my pleasure.
So, the first thing that I'm curious about is why did you pick the Navy as opposed to like Air Force or like Army?
The best answer is that the bases are in nice places. I was kind of looking forward to where I was going to be able to serve. And when I did some research, the Navy really had most of the opportunity of going into locations where I knew I would want to go. Even if I go abroad, a lot of the bases are in generally great locations. And even the prospect of serving on a ship, I kind of enjoyed that aspect, if that is something that I do. And then also it was after I applied to Navy that I kind of realized that I had a lot of family connection. Both my grandfathers served in the Navy, and so that kind of heightened that decision. But initially, it was and that's another consideration for anybody who is looking to apply. They'll find that the opportunities, at least at the time I was applying, get take into consideration. I applied back in 2016, 2017. Navy was offering a lot more scholarships than the other branches. I think Air Force at the time was offering maybe two for the whole country, and Army was maybe slightly more, but Navy offered close to like 20 or 30 scholarships. So it was a lot. I mean, still competitive, but a lot less so than the other branches. So I'd
So,
say those three reasons.
you said like the idea of serving on a ship. So you would there's no like bases like on land, like you would always be at sea, basically.
Yeah, so sorry. Yeah, majority of people will be stateside, meaning our primary duty is to fix teeth before new recruits go and ship off, somewhere. However, there are on aircraft carriers, they do have some people stationed on uh, on a ship, and so it's an amazing. If you have the chance to go tour one, they do have like during Fleet Week I toured one of the facilities and they have state of the art equipment. And it's essentially a floating city, and you're serving those servicemen who are on the aircraft carrier. So yeah, certain people do end up actually serving on those ships.
Okay. So let's start off with the benefits of a scholarship. Like what if I receive this scholarship, what can I expect to get?
Yeah, so in terms of benefits, that was really, I guess, when it came up and time to really go into dental school and look at how much debt I was going to have. I'm ultimately not coming out debt free is the number one benefit. Number two is that you during dental school are receiving a small monthly stipend, and that's the same no matter where you're going to dental school. So for me in San Francisco, it barely covers rent. But if you are going to someplace else that has lower cost of living, it's a considerable amount of money, and it might be enough that you can live fairly comfortably. So that's benefit number two, another financial benefit. Third is aside from the finances, is that you're going to have military, you're going to be a veteran, right? You're going to have those military benefits for the rest of your life.
Right.
Um, the VA loan is an amazing benefit that you can use to buy property and houses with no money down. And so I'm looking at that now as I look to purchasing a home. That's going to really benefit me and my family for our future.
Mhm.
Uh, and lastly, now especially graduating with a lot of the uncertainty with COVID, a lot of positions in terms of going into private practice have kind of closed down. We were out of clinic for 4 full months. So a lot of my classmates just don't feel prepared really going out into private practice. So I'm going out into this kind of extension of dental school where I get to, learn more, but also grow in this Navy practice setting, and get more experience in kind of a safe environment rather than going straight into like an ownership or associateship.
Would you
So I
say
feel
that
really blessed in that. Mhm.
would you say that's similar to like a GPR? Like you're getting
So
more experience?
so that maybe that's another clarification. So now, like, kind of fast forward, if you do get the scholarship, and this is something that's I didn't even know coming in, but at the end, you have the opportunity to apply for an AGD or GPR through the military,
Oh,
and you'll be on a base, and you'll actually go through some of the rotations, and you'll basically you're more likely to do more of the advanced procedures later on. I chose not to do that route because it adds a fifth year essentially. It adds an extra year, so you do that GPR and then you go in to serve your time back. So I'm choosing to just go in and do what's called a credentialing tour, and which means that I'm going to be still kind of, I don't know, under the watchful eye of someone higher ranking for this year down in San Diego that I'm about to go into. And then after that, I'll have another 3 years of additional service. So
so
I don't get as much guidance maybe as a GPR AGD program, right? You don't have the schooling, there's no classes or coursework, but you are still getting that more comfortable and increasing your speed, because that's really what it is. After you're at this point, hopefully you're feeling competent enough to tackle anything clinically, uh, but still working on speed and getting more proficient.
and could you please describe for our viewers, how do you know the amount of years that you need to serve in the Navy?
Thank you. It depends on how many years you took the scholarship for. So, for most schools, right, at UCSF, they're paying for 4 years of school, so I owe them 4 years of service. Some of my class, or some of actually, I think that this is the last year that they offered a 3 year scholarship for people at UOP. So they went to 3 years of school and now are going to serve back 3 years. However, I think the entering class now, even if they're only getting 3 years of school paid for, they actually have 4 years of service, uh, just because they were, I don't know, the equity they were looking at. So there are
And
not very many 3 year scholarships anymore.
okay, I didn't know that they were gonna make the UOP one a 4-year now. That's interesting.
Yeah,
So
yeah.
what if you're considering a specialty? How does that work?
Great question. There's a few ways you can explore that. One is especially if you're looking at like oral surgery, for example, which is in high demand in most of the military branches. That's one where it might make sense to actually specialize through the military, because they do have their own programs, and you can go through and actually get your specialty through them. There are other programs like I'm exploring endodontics. And so if I want to do endo, it's not as high demand in the military, and there's not as many billets for it. So I'm not able to go out and, let's say, apply right now for my military or for the endo program. So what I'm planning to do is actually serve my 4 years as a general dentist with the Navy, call that, good, and I'm going to go and apply for my endo program and just any civilian program, just as you would coming out of dental school. I guess those are two options. The third maybe is that you can, in some instances, there's an opportunity where you can, and generally it's the people who go to like an AGD or GPR first, like I was describing before,
Mhm.
they might have the opportunity to then go to one of the endo or perio programs, um, and do it that route.
And
I
would
have a Yeah.
yeah, sorry, would they have to serve like additional years as well?
Yeah, so any schooling that the military is paying for, you're going to pay that back. So I have a friend right now who's actually in the perio program at UCSF, and she is uh, through the Navy, serving or doing her 3 years of perio right now. So she did 4 years of dental school, 3 years of perio. So she'll actually owe 7 years of service back to the military, but as a periodontist, right? So she'll be actually working as a specialist within the Navy. in that route. So in that way, it is nice to get it done early, right? If you do know what you want to do, you're able to go and serve as that specialist rather than serving as, a general dentist like I'm going to do and then doing your specialty training.
Mhm.
She's going to be able to just serve as the specialist the whole time.
And they would still like you still receive a salary, right? When you're
Correct.
studying it.
Yep. Yeah, yeah. So yeah, if you do that route, you're getting paid your full military stipend. So that's a really great way to go.
Awesome. And with regards to like the location, like where you're stationed, how do you find out like when and how and do you get a say in like where you go?
Kind of. Yeah. So that's, I guess we didn't talk really about the cons, right? So the biggest downside of choosing this military option is that you are giving up really a lot of your freedom to settle down for the next 4 years, however many years you're serving, because the military does move you, and you're going where the need is, and so you don't really have that comfort or in that security of knowing where you're going to be. So it wasn't until the December of my 4th year, so just this past December, that I put in preferences to where I wanted to go. So they gave me like a list of all the options, and I had to select, I think, the top six, which was tough because there was only like 10 to choose from, and three of them were in Florida. So you end up listing and sorting out all of these different programs, and giving certain, and then you can like designate reasons if there are specific reasons that you want to be, closer to family, or they do try to be accommodating. um, but yeah, so you just kind of send in a list of preferences, and then January we found out where we're going to go. So yeah, we'll be, and then once we graduate, we'll be moving out.
Okay, so you basically found out like 6 months before you graduate.
Yeah, yeah. So that was good, which was much quicker than my colleagues last year because of COVID. I think it got delayed quite a bit, and so they only had like maybe 3 or 4 months beforehand.
Okay.
To,
So, can you describe the application process a little bit? Like,
Mhm.
the timeline and what you need to fill out just to get your name into the pot?
Yeah, yeah. So contacting a recruiter in your area, or if you can just, it depends on where you live, but a lot of times there are recruiters associated with undergrad programs, and then they'll know who to connect you to in terms of like for the graduate programs.
Mhm.
And getting in contact with someone early on is best. I started the around the same time as my application. I just like started figuring out who I needed to contact because I knew I wanted someone else to pay for dental school. So
Mhm.
I figured out, this is the scholarship program I wanted to go into versus the others, because there are multiple, and started contacting recruiters. And then the biggest benefit that ultimately can set you apart is your DAT score. Because if you score above a 20, I think it was a 21 on your academic average, they assume that you're going to get into a program, right? And so then you're able to put your application in December, versus others, right? That December before you go to dental school, right?
Right. Okay.
Um, so that December, I was able to apply for the scholarship program with that academic average. Had I scored lower, I would have to have waited for an acceptance from a dental school. So that would put me behind the whole month, right before I got that acceptance, so that I would be able to actually apply. So that I think really set me apart, and I was able to get that application in.
So you have to get into dental school first and then apply
If you don't have the 21, yeah.
if you don't.
You can have all your application stuff ready. I would definitely recommend having it already.
Mhm.
But if you have a lower academic average, then lower than a 21, then they need to see that you've gotten into a dental school before you can actually finally submit the application.
Gotcha. And then once, let's say you get the scholarship, do you get to decide what school you go to, or is it
Yeah.
like, okay?
Yeah, it's not dependent on which dental school or anything. Yeah, they give them out throughout the country, and you can decide where when you want to go.
Oh, awesome. So, and what did you need to include in the application?
Yeah, so kind of like a standard application, there was your cover letter, a CV. The only thing that was maybe a little different, the cover letter, they call it a letter of intent, and it's a little bit more involved and kind of directed towards the Navy. So there is some special language that you might want to include there. And then I had a letter of recommendation, just one that came from my dental school, essentially. So it was very similar to the dental school application, but it was only like one letter of recommendation, a cover letter, resume, and then the DAT scores and transcripts
So,
that
in
fills
the
out.
cover letter, is that like similar to a personal statement?
Very much similar, yeah.
So, how do you say like you want to join the Navy without saying like I just want to have my school paid for and get the benefits? Like, what did
Yeah,
you
so
say?
having some sort of connection that you can really relate to, whether it is serving your country and having that service, because there is something that you can take pride in that. Uh, I always, and if it helps listeners, I think of the fact that you're a military officer that is taking care of the teeth for people who are serving the country, and making sure that they're not in pain while they're doing so. There is a certain pride to that, and it is pretty cool. When I took a tour of the ship, that everybody stops and salutes the dentist. Everybody respects the doctors, and
Oh, wow.
ultimately having that position, I think, is really admirable, and has more benefits than just the um, not being in debt.
So, when did you get to tour the ship? Was that like after you got the scholarship, or do they allow
That
you
was
to go?
afterwards. Yeah. So that was one of the benefits of living in San Francisco. We have our Fleet Week every year. And so during Fleet Week, one of the ships was docked here, and it was actually one of my colleagues at UOP worked out a relationship with the dentist on board that ship, and we got a tour.
Oh,
So that was
cool.
actually really cool. Yeah.
That's very neat. Yeah. So, what was your experience working with the recruiters? Because I've had friends who just went into the Navy, like not through dentistry, and they said like
Mhm.
recruiters tried to pull something through like the contracts or like something that they didn't talk about, explicitly. Like, so what was your experience with your recruiter?
I didn't have a negative experience because I've heard the same things that you have, that, don't, not to trust the recruiters, and there's a lot of like shady stuff, but I didn't have any of those experiences. There, so having that connection, because they're really your only real contact in that meantime.
Mhm.
Yes, you are going to have to sign a contract, but that's really ultimately what you're after, right? You want to be able to sign that contract.
Right.
There is, you do have to go through MEPS, which is just essentially making sure that you are in good, okay physical condition. You don't even have to be in great physical condition. They're going to ask for essentially like a clearance letter from doctor's office, that you don't have any prior uh, medical issues. You'll have a drug screening, but ultimately, the recruiting process gets you to the place where you can actually get that scholarship.
Right.
Then you'll actually get commissioned um, afterwards, and so there's a whole ceremony where you'll go through to actually get commissioned um, into the Navy. Uh,
Okay. So I know you touched on this a little bit in the beginning of this video, but how to the best of your knowledge, like how competitive is the scholarship now? Like if I'm really into this and I apply for it, can I expect to get it or is it still like the luck of the draw?
Um, I guess a little bit in between, right? You're not. I wouldn't say it's a given. No, it's. I would think. I haven't seen any statistics. They kind of bury those, but I would think it's getting more competitive because of COVID, and just like applications and positions at residency programs are getting more competitive. I would imagine the Navy is as well. And so definitely working towards the higher DAT score, I think ultimately is, whether there's any validity to it or not, is still one thing that I think can help. And really just kind of being a great, if you're a great dental school applicant, you'll be a great applicant towards the military scholarship, because ultimately they're looking for someone who is going to be, a good dentist serving their country, and um, will make it through dental school and be able to get there, right? That's ultimately what they're looking for.
Okay. Yeah, that makes sense. So they go hand in hand with each other.
Yeah,
Okay.
yeah,
So, how does training go with the Navy? Do you go like between like summers or is it
yeah. A
as
lot of it,
intensive as like other like if you're just in the Navy, is it just as intensive or
not as intense as a basic training. So with the Navy, you're going to go to what's called an ODS, or Officer Development School, and that is a 5-week training out in Newport, Rhode Island. And your when you do it is kind of dependent on your school schedule.
okay.
Uh, for some schools, you're able to do it, between like the D1, D2 year summer. Others are too full and you end up doing it after graduation, post graduation. And so you'll go to Rhode Island for 5 weeks before you report to your first duty station.
Mhm.
So there's a lot of variability on that when, but those are two of the biggest, I think, common times that people end up doing that training. But you end up you learn. That's kind of where you end up learning the military side, because ultimately those during your dental school experience, your job is to be a great dental student, uh, and sometimes you almost forget that you have this Navy side until you go to that training and you learn, who to salute, how to salute, what uniforms you wear when, the importance of, making your bed and that regimen. There's a lot of those aspects that you get during that training, but
Do you train with like other dental students or is it with like other Navy
the
uh
whole medical core generally. So yeah, you have like because there's similar scholarships for nursing, medicine, pharmacy, and so the medical core generally goes to the training altogether.
okay.
And so you'll meet some of those colleagues, but yeah, a lot of them will be dentistry too.
Okay. Cool. So is this something that you can uh network your way into? So I know like for dental school, they may not say like, oh, like you can show your face a little bit to the admissions teams, but like, is this the same as with the Navy scholarship? Can you like talk to like a lot of recruiters and just get your name out there, or does that not make a difference?
It definitely helps to, you want to be a squeaky wheel, right? Because the recruiters are doing a lot, and some recruiters are better than others, or not necessarily better than others, but it might push your paperwork a little bit quicker. So yes, it's less networking and more of a uh, being active and making sure that you're not getting forgotten, because everybody's busy, and unless you're going to be your only advocate, right? So you're not, no one else is going to advocate for you because you're, just an email in their inbox. And so really, if you can find a phone number, that's great. If you can get into, emailing other people, you definitely don't want to be annoying, but you don't want to get forgotten in the shuffle. So if you know it is something that you want, I would say yes, contacting maybe not multiple recruiters, but at least getting in touch with a recruiter, and if they're not the right person, going to the person who is, and following that chain.
Mhm.
Because I initially, when I emailed, I wasn't in. I think I contacted someone who wasn't even in Arizona. I was just able to get a contact information from someone in the Midwest who I thought might be able to point me in the right direction. um, and fortunately he did and was able to get in the right track. So I think in that way, yes, it is kind of a network, more of a web of people, because the military does have many levels, and there are a lot of people doing those different jobs. So I would be active, right? Don't just think that it's gonna happen. Make it happen.
Yeah, that's some great advice. So, in addition to being active and like you said, like trying to get a really high DAT score, if a predent is serious about like receiving this Navy scholarship, what can they do to like what's your last bit of advice for us that like to like increase our chances?
Mm-hmm. Yeah, DAT scores and a good letter of recommendation always helps. You know, if you're the, I think a lot of times, especially for the dental school application, you know, you're looking at these science professors who are writing these letters of recommendation. If you can really get a solid letter of recommendation from, you know, a dentist or uh, someone who's going to advocate for you, that definitely helps. And I think just puts you at the top of the pile. And ultimately, if you're going to be, like I said before, if you're a good applicant for dental school, you're going to be a good applicant. So being the best applicant you can be for dental school will already have prepared you to do this application process. You just got to make sure that you're one on time and filing in the right times, and two, like I said before, not making sure you're not getting forgotten in that stack. So those
All
two
right.
things should be really good.
That's
Uh,
a lot of helpful advice.
yeah, no, I think that it's ultimately if you're someone who ultimate really wants to serve, because it's not for everyone. I think, you know, yes, because there are other options to get dental school paid for. It's this is something that I think is a great option if you do, if you don't, if you're not um, if you don't have a roadblock against moving
Mhm.
around and not having a place you can really call home for a few years, and really are looking to get more experience and serve your country, I think it's a good opportunity.
Yeah. So, all right, thank you so much, Kevin. I really appreciate that. If any one of our viewers had some more questions for you, is it possible they can reach you through either like email or social media?
Yeah, you can find me on Instagram. I'm at that's my dentist. Or you can shoot me an email. It's kevin.hildebrandt at ucsf.edu. Those would be the two easiest ways.
Okay. Yeah, and we'll include that in the description of the
Great.
video. So everyone, if you haven't already, make sure to hit that like and subscribe button. And if you want to receive a notification when we post a new video, hit that notification bell. If you have any questions for us at FutureDDS, just send us a DM at underscore FutureDDS, and we'll try to reply as soon as possible. And until next time, see y'all then.